Hello, everybody. Good afternoon. Welcome to yet another edition of Health Darbaar. Myself, Dr. Anjali Agarwal. Today, my topic of discussion is back pain in the times when we are working from home. A pandemic made us sit at home and we had to go online, and that requires us to sit for long hours in front of our laptops and desktops and working from home. And that requires us to be totally sedentary because when we are in the house, there's limited movement in the house and हम ज़्यादा चल नहीं पाते हैं because of the limited space, and our area of work zone is also very restricted within the house. So working from home के क्या क्या नुकसान हो रहे हैं आजकल is mainly affecting our back and our spine because जैसे जैसे लोग बैठ रहे हैं लंबे लंबे समय पे बैठ रहे हैं लॉन्ग लॉन्ग आवर्स पे बैठ रहे हैं and उस कारण से there's lot of issues which is coming up in the lower back. And आधे से ज्यादा लोग जो work from home कर रहे हैं they are sitting non-stop, like they're not taking frequent breaks, which is a very idle situation to have. You know, you should be taking adequate breaks in between, but that is not happening in many of the people's case because मेरे आधे से ज्यादा patients को मेरे को बार बार यही बोलना पड़ता है, get up from your chair as often as possible, take many breaks to have some glass of water. Don't keep your glass of water within the range of your working zone, keep it somewhere far off so you get some moment to walk around the house, you get some activities in your house within the, like while you work at home. Now the major concept kya hota hai when you're working in the piece in the environment where only PC and laptop hai, up front of the body, like which is the anterior part of our body, जो हम लोग हमेशा सामने अपने कंप्यूटर को देख रहे हैं, तो we lose this movement, the corner movements, the side movements. As a result of that, हमारी जो neck है, हमारा जो spine है, they also kind of modify according to the the culture of work we are having or the kind of nature of work we are doing. As a result of this, we see a lot of children, small children जिन्होंने बहुत सारा वर्किंग फ्रॉम होम करके स्टडी कर रहे हैं, जो यंगस्टर्स हैं 20 to 30 years के एज ग्रुप में हैं, they are non-stop working on the PC without even blinking their eyes, and because of that their posture gets affected. So our lot of issues with our spine are connected with our eyeballs. So if our eyeballs are not moving left and right, up and down, there's rotatory movement is not there, our back gets affected, and that changes the whole dynamics and the biomechanics of the spine. So जब हम बैठ रहे हैं, how we are seated on in front of the computer is very important. सब हम लोग जब कंप्यूटर बैठ रहे हैं तो we either leaning too forward, either we leaning backward and literally falling off the chair, or literally having a computer too high so that our neck is looking very high. That can lead into a lot of neck pain, lot of cervical spondylitis gets aggravated because of this kind of postures. And there is also times when people are having a lot of pain in their buttock muscles, which travels down their legs, causing leading to sciatica kind of pain. So a lot of my patients now complain कि बैठे बैठे उनको बहुत पेन आ रहा है बट से लेकर पैरों तक, एक पैर के नीचे बहुत एक नस दब रही है, उसमें बहुत पेन आ रहा है. This is a common symptom which a lot of people working from home are talking about. They are also talking about a lot of muscle pain or fatigue, what we call as fibromyalgia kind of symptoms. ये इसलिए हो रहा है जब आप घंटों बैठे रहते हैं तो muscle gets fatigued and tired. They need to get some kind of momentum or activity to keep the muscles and the blood flow going in those muscles all the time. उस कारण से जो उनका पेन है, उनका जो एक्टिविटीज हैं, वो सारी चीजें उनके पेन को अफेक्ट करती हैं. Now look at two aspects. Like we were born as a primate, right? Our ancestors were the monkeys and the apes, and we homo as a Homo sapien, we kind of got their roots and we kind of prolonged in the evaluation journey. उस समय they were in a four-legged animal. They would crawl, they'll jump on the trees, they will pluck. fruits or they'll kill an animal. And as the evolution progressed, the man became more modernized. So they started to hunt animals, they started to grow their crops, so they became more upright posture. Rather than being four pedal, they became bipedal. And bipedal होने से the spine is almost compromised because the gravitational force जो है it helps to pull the spine vertebrae down. अब जब खड़े होते हैं तो हमारा स्पाइन भी बहुत अच्छा इफेक्टिवली काम करता है. बट इफ यू आर सीटेड ऑल द टाइम आवर वर्टिब्रेस गेट्स कंप्रेस्ड. उन वर्टिब्रेस के बीच में कुशन लाइक जेली लाइक स्ट्रक्चर्स होते हैं, उनको हम डिस्क बोलते हैं. They get compressed, and all the time if you're seated more number of hours, these disc jellies will get affected in a long way. In a long way, in the sense, number of years you're seated, the number of times you'll have injury to the disc, and that will compromise your whole back, and that will lead into chronic back pains many times. Now, इस कारण से क्या होता है कि as the disc gets compressed, lot of people complain of pain going down their entire leg, like both the legs there, the pain is going down, which we call as lumbar stenosis or lumbar stenosis. And that is common in cases when people are just kind of leaning backward, getting the computer onto their face. So it's very important. First, A is posture. हम कैसे बैठ रहे हैं when we are working from home. Second is हम कितना movement करते हैं while we are working from home. Thirdly, the amount of hydration or amount of water we are having. Fourthly, the amount of nutrition or the quality of nutrition. Fifthly, the amount of sleep we are having while we are working from home. And not last but not the least, the kind of sunlight exposure which we have while working from home. Now, two things which went as a drawback is when we are going to office, we would add in more momentum. We'll add in more steps all throughout the day. We'll get exposed to sunlight while traveling to the office, while getting back from the office to home. And ये जो sunlight exposure होता है morning में और evening में is very important for an individual to keep their muscular structures very good and agile, and good intake of vitamin D happens, good absorption of vitamin D happens when we are exposed to the natural sunlight while going to work. But now working from home, maybe we go for a small walk that would help us, like morning, utke go and get exposed to this morning sunlight so that you get exposed to vitamin D. When you walk for at least 30 to 40 minutes, do a brisk walk whereby you can feel that you are talking and walking and you feel like you were having difficulty to talk and walk. उस level पे आप exercise करके walk करिए so that your muscle efficiency or your cardiac efficiency is improving. That way the blood circulation in the overall part of the body will also get better, and your back muscles and your spine will get very good, and will get very good blood supply and very natural hydration for your disc. Actually, the more movement you add, it's called as motion is equal to lotion for your disc, is motion is equal to lotion for your spine. So jitna aap move karte ho early morning, it will help to start your day in a very nice and a positive mood, basically getting sun and momentum. Second thing is amount of water you have throughout the day. जो घर में जब रहते हैं तो the intake of coffee and tea has increased, and that is again another big problem for the skeletal system. The good amount of bone is manufactured, and the caffeine intake and every kind of food which we take will affect the bone quality. So a lot of people who have 4 to 5 mugs of coffee or tea are deteriorating the quality of their bones. So it's important that you stick to a limited quantity of tea and coffee so that your bone health is maintained, and you have adequate amount of water, which could be any kind of buttermilk you can have, or any kind of watery drink, just like herbal infused teas like tulsi water or jeera water. These are all good additives rather than having a tea and a coffee, because the bone health is definitely affected with a good amount of herbs being introduced in the body. And thirdly is your posture, how you sit. So when I'm sitting in front of my computer, My neck should be at an angle about 10 to 15 degree with my screen of the computer. My shoulders, my elbow, and my arm should be about 90 to 90 degree with my typing screen. My legs and my hip and my knee and my ankle should be at about 90 degree, seated, well placed onto the ground, and my back should be well arched, supported on a chair. Now, many times I always tell people also to sit on a sturdy wooden chair rather than a rolly chair with wheels, because we have seen that people who sit on the wheelie chairs tend to draw their back in an awkward posture. And that also affects the overall biomechanics of our spine. Sitting on a sturdy, good furniture is very, very important, like a good wooden furniture. It helps to retain the strength of the spine. It gives you a push from the lower half of your pelvic and helps to maintain a good neutral pelvis, which is required while you're seated, and will break the monotony of you kind of leaning onto one side. So people who sit on chairs which have wheels generally, because office में सारी chairs वैसी ही होती हैं, जब ऐसे बैठते हैं तो they tend to kind of slouch on one side of the body. So what now I'm seeing is people who are working from home are getting a very compromised body spine. So spine is getting curved. So एक side में अगर right side में ज़्यादा बैठ रहे हैं tilt करके, so the spine is moving to the right. But in effect, if they are using a wooden chair, उस कारण से they don't have any provision to tilt basically. The body is all the time held in a upright position. Apart from sitting on a chair, it's advisable that you sit on a floor sometimes. You can sit in Padmasana, get your desk, in a way where you can put it on the floor and work in front of the PC, and utilize the option of standing desk, where you can put a desk on top of your working desk and raise the height of your computer and stand for and work in alternative way. You can sit on the floor for a few hours in a day. You can sit on a chair for a few hours in a day. You can stand and work. Break the monotony. The rule of thumb is break the monotony of, just sitting in one position, because the body gets monotonous and that will affect our cognitive skills as a person also. And a lot of people complain about a lot of headaches and vertigo, which is also coming because the back is compromised. Now the back pain which is there will aggravate and will be into bits and pieces of aggravating your whole posture. So as a result of back pain, people tend to slouch and sit on one side because to avoid that muscle from paining, and that cause a vicious cycle of pain reaching your neck, reaching your head, affecting the overall biorhythm of your spine. So the key rule is segregate movements throughout the day, move as much as possible throughout the day. So get your water bottle from the kitchen or from different room to the another room. Try to get up maybe 10 to 20 minutes, every 10 to 20 minutes. Do some stretches, kind of just kind of pulling your arm, pulling it up, turning your neck side to side. These are exercises which you should be incorporating every 10 to 15 minutes just between your work schedule, and it helps to increase the elasticity of the tissue, increase the flexibility of the tissue, and your blood flow to the system also improves, your concentration also improves. Now what happens is if I'm slouch all day, my chest cavity will decrease, so the amount of oxygen I breathe in or the amount of air I need to inhale for my breathing is also reduced. So you got to sit upright, let your chin and your nose be in a very good position, especially your earlobe should be at the same line with your shoulder. And if this posture, if you maintain, it will help in good digestion, it will help in good breathing postures, and it also helps in reducing the back pain. Many times people can use a wedge shaped cushion. So the cushion आता है जिसमें we raise the height of your tailbone versus your hamstring muscle. So between your thigh muscle and your butt muscle, there's this kind of a gap which is called as a wedge shaped cushion. It helps to give you a bounce into your, like the hip area, and elevates your pelvic and makes it in your neutral position. And that kind of sitting kind of style is very advisable if you're working from long hours. And also people are complaining of a lot of pain in the back because of the tailbone getting very sensitive because of sitting for long. They can use a tailbone cutout cushion or a wedge shaped coccyx cutout cushion, a round cylindrical cutout cushion to sit and then work. So that will help you to stretch your back muscles and yeah, sorry. So we lost for a second. Also, important thing is how you are typing. Okay, so when you type going forward, you pull the back muscles a lot, and they call a lot of shear stress at the back. So it's important to be upright, and so that your lower part of the body is not getting compromised or painful. Also, try to add in a lot of stretches for the lower half of the body where you twist your spine side to side so that you bring about a lot of hydration and blood flow to the lower half of your spine. And also, when you're trying to stand up, try to stand by wearing weight on equal legs also while you're studying, while you're working, because if you're leaning onto one side, again, the back muscles will spasm, and then the back muscles will give you a lot of lot of kind of pain and everything. So try to stand upright, bear weight on both legs, try to add in a little bit of jogging movement throughout the day while you're working also, because it'll add in a lot of calf muscles to pump blood to your lower half of the body. Add in some kind of stretches for the hip, so that that will help you to be more agile also. Okay, so let's see what the questions are. Right. So, sorry, sorry. The key thing important for us is to always move, always be sitting in a proper posture so that your legs are not dangling in the air. So people who are very, very short should have a chair height whereby the legs are touching the ground. They should not have a legs dangling in the air, because that will again compromise your lower lumbar region of the spine. And also those who are very tall, make sure that you're not just kind of slouching in front of the computer. Choose your desk right, choose your furniture right when you're working out. Have a proper lighting in the room. So a lot of people are having a lot of back pain because there's very poor lighting in the room where they're working. So either they're working in stuck in one corner of the room. As a result of that, they are like kind of very claustrophobically sitting on a chair, which is not giving them comfort. They keep fiddling, and as a result, the back muscles go into constant spasm, and a series of trigger points form around the whole back muscles and the hip muscles and the buttock muscles, which again forms a vicious cycle of pain for them. So always remember that you got to add an adequate amount of good lighting in the room, and have a good system to relax and detox in between work, because a very inactive body will again become stagnant and will attract diseases. So, and that again affects your back pain. So the number of, and we know that sitting is the new smoking. So the number of hours you are sitting, you are decreasing your lifespan also. That's what is the new thing which is going on. So we have to understand that we are seated only to work, but we are not seated all the time post work also. So if you finish your work, make sure in the evening you try to go and take a stroll for again 30 to 40 minutes. Getting some fresh oxygen is very, very important. Break the monotony of work and sedentary lifestyle. Do not just come from work in seated manner and then again go back into a seated manner to watch a television or a watch a movie seated always. Like, you got to discontinue your body from being seated all the time, and that way you can break the chain of back pains. And the prime reason of back pain also is in many people is they cross their legs and sit while they're working. When they cross, you kind of distort your hip, and that causes a lot of issue in the whole spinal alignment. And that is the reason we call people is always place your knees equally distanced, place your legs equally distanced, and don't try to cross your knees over and over again. Once when you want to cross, do them with a good stretch, but don't keep continuing doing it. Okay. And another good thing, always important, is trying to do a spinal curls. When you're seated on a chair, try to do a cat and camel stretch multiple times in the whole time of the duration of your work. This helps to give the joints a lot of hydration and helps to keep your joints very, very much in good size and good shape. So another thing, what we see, a lot of women have a lot of back pain if they are, around their periods, and also women who are pregnant and also working from home. Please make sure you have a good furniture, good ergonomics when you're seated in front of the PC. Make sure you're seated with a bed-shaped cushion, or you can also sit on an exercise ball which is of your size, and it helps to keep your pelvic floor very active and pelvic floor very relaxed at the same time taking care of your core muscles. So the prime reason your back goes for a toss when we're seated for long, and especially when you're working from home, is we are using any kind of postures to sit. We're not aware, we're not bodily aware. While in the office, we see people are watching us, we tend to sit in a proper position. But I see a lot of people are having back pain because they're seated on the bed and they're, kind of sliding to one side, putting their elbow, resting it on a chair, and then working. This has very, very detrimental effect on your whole spinal alignment. And that is the reason why I keep telling is always add momentum throughout the day so that you can break that monotony of needing to lean onto one side of the body. When does the body leans to one side is when it's getting fatigued or when it is getting tired. सो बहुत सारी चीजें हमारे बैक पेन को इफेक्ट करती हैं. मेन थिंग इज हाउ यू आर सीटेड, which kind of chair you used to use when you are working, how much of water you are having, because water is your very important nutrient to nourish your disc actually. और अगर हम पूरे दिन बस बैठे रहेंगे तो बॉडी भी अकड़ जाती है, एंड व्हेन the body is very very tight and the body is very very getting worn out because of long sitting hours, or we call it as a fatigue which is developed because long sitting hours. And because of that your muscles get very very weak, and especially your core muscles. Core muscles are your muscles which are in your abdomen muscles, your back muscles, the pelvic floor muscles, and these muscles they work in sync together to activate and keep our spine very good and agile. So it's important that early morning उठ के आप थोड़ी core exercise करिए, which could be go for a walk. That's one thing. Second thing, you can do with basic yoga stretches. Do some desktop stretches, which I have always talked in my previous sessions also. जहाँ पे आप अपनी बॉडी को every 20 minutes उठ के थोड़े stretches करके you are making it very agile. And important, very very important thing is do not slouch as you go towards the computer, because जितना आप slouch कर रहे हो spine की जो age है उतनी ज्यादा बढ़ती जा रही है. So always remember, you can still remain with a very good healthy spine if you start working on these tips from today. And the basic tips for today is कि आप बैठो, but involve a lot of changes in your movement. कभी आप नीचे बैठ रहे हो, कभी आप खड़े होकर काम कर रहे हो, कभी आप लाइक सीटेड ऑन अ प्रॉपर चेयर कर रहे हो. एंड चेयर भी मैंने बता दिया है ऑप्शन कि आप व्हील चेयर के जगह एक स्टर्डी वुडन चेयर पे काम करने से the spine health is very good, rather than having a wheelie chair which causes the spine to kind of move to one side of the corner. These are the disadvantages मैंने देखे हैं for people who are working from home. Now, when you're working from home, you tend to put on a lot of weight around your abdomen and especially on your torso. And as a result of that, lot of secondary metabolic syndromes, जैसे diabetes and PCOS in women आ रहा है, because of which also a lot of back pain issues are coming up. So make sure your weight is kept idle, you're eating adequate amount of food, nutrition, but not putting on weight. That's important. And also important is your nutrition, like your vitamin D and vitamin B12. ये सारी चीजें बहुत important है, because when you are not moving, you kind of don't assimilate food well. And जितना हमारा movement prior to the pandemic prior to the work from home scenarios we would not be sedentary all the time, right? We would go to the cafeteria, grab something from there. We'll go to the which will be long distance. We'll use steps to walk, and sometimes we will kind of use a lot of walking space, which is long distance between one cubicle to another cubicle, so that the amount of calories burnt during those times were more for us than when we are sedentary and working from home. As a result of that, every calorie which gets added to our body, every kind of weight which gets added onto our body affects the spine. So keep your weight in check. Don't put on weight. That's very important. Every time we put on weight, we are adding more weight onto our spine and the spine gets compromised. So, and because of the work from home, I've seen that people have started to use their mobile all the time. So while they're working, they're also on their mobile and their head is always down. And as a result of that, spine का जो posture है वो बहुत curved हो जा रहा है. इसको हम बोलते हैं kyphotic spine. And as a result of that, lot of organs are getting, affected, which could be your digestion, your gut health gets compromised, your breathing capacity gets compromised, and more so, the overall back is getting affected because if we don't do the basic gut health management, we don't do the basic breathing management, we will have the back which is getting compromised. So the in gist I want to tell you is that working from home has been a boon for a lot of people because people were safe, not getting exposed much. But at the same time, if we are not moving, if we are not gathering a good amount of momentum and steps in a day, you're putting on more weight, which affects our back. At the same time, our seating is not proper. That also affects our, the spinal health. And overall, our exposure to the sun is also very much compromised. So always remember, we can enact and we can adapt and we can change the ways we are kind of working from home by making our life more simpler and making our seating work very simpler. So good amount of momentum you try to add in throughout the day. You can go for a spot jog to help the bone muscles to get stronger and stand as often as possible. Whenever you stand, your spinal disc will be very thankful to us, will be very thankful to you because they get erect and the vertebrae also get aligned. But if you're seated all day, they're all crunched up and there's a lot of wear and tear which will happen in the lower back. So stand as often as possible. Second thing is try to add in a little bit of weight training throughout the day. Like you can add in some ankle weights, stop, can spot march on the spot, which will add in bone mass, the bone densitometer, which we do for BMD to check for osteoporosis, that would decrease. So about 80% of the patients we see now and children also, they're suffering from something called as vitamin D deficiency. As a result of that, they're also osteoporotic because they are not standing. वेट बेरिंग एक्सरसाइज जहाँ पे आप खड़े होते हो, आप पैरों पे वेट डालते हो, उससे आपका जो स्पाइनल हेल्थ है वो काफी बेटर हो जाएगा, काफी इंप्रूव हो जाएगा. So add in some amount of ankle weights and stand and walk with it, squat march on the spot with the ankle weights. These are all very good ways to strengthen the lower half of your body and the back. Also important is to add in foods which can help you not deteriorate the bone health, which could be good amount of calcium and vitamin D in the form of soya proteins, good protein intake, good milk protein, good yogurt, so that your back is always thankful to you. And do not always try to sleep on a side way postures when you're trying to watch a television or you're watching a laptop or you're watching a phone and trying to work on a side posture, because that posture you'll keep maintaining for long term and that will cause a compromise option for the disc to kind of slip out. So discs generally don't slip out. That's just a myth we call it. But what is very very important is how we are functional when we are working at home. So working at home means it's a bliss that you don't have to travel, you don't have to commute. Your back is safe from all the potholes and all the wear and tear which will come because of traveling. But at the same time, too much sedentary habits will again lead into a spine which is very compromised. So remember to exercise and do some kind of a cobra pose exercise every time in a seated way. Lot of Surya Namaskars can be done in a seated form. So people who don't have an option of doing the exercise on the ground can sit on the chair and can do a seated Surya Namaskar. That will open up all your stiff joints, will help your muscles to be good. So we are almost reaching the end of the sessions. And if you have a question, you can put it in the chat box and we can come back to you with more such, interesting sessions about the back pain management and how people can work effectively at home. So the key point is remember to keep your postures good. Key point is more movement. Key point is hydration, nutrition, adequate sunlight, and add in good weight training exercises which can be done within the home surrounding. Go for a walk and invest in a good furniture, ergonomically friendly, and good lighting systems, and break the monotony of sedentary habits. Thank you. This thereby I end the session here. And thank you so much, all of you. I do tell you